Welcome to EAC Speaks, the podcast where we dive deep into the movement to end the HIV epidemic right here in the heart of the South, Arkansas. I'm your host, Eddie Wiley, and together we're going to explore the stories, insights, and passion that fuels engaging Arkansas community's mission. Join us on this journey as we unite voices and take meaningful steps toward a world free of HIV stigma. Now, get ready for a conversation that matters. This is EAC Speaks. Hey, what's up, everybody? It's Eddie, your host of EAC Speaks, where we're always epic, empowering, preventing, innovating, and connecting in anticipation of ending the HIV epidemic in Arkansas. And I'm so excited to be talking to one of EAC's own, Whitley. Hey, Whitley.
Hi, Eddie. Thanks for having me.
Yes, I'm so excited to be talking to you about your work and even your personal connection to Arkansas. So let's begin. Tell us a little bit about yourself, your background, and your experience as a community health worker.
I am Whitley Hopkins, and I have lived in Arkansas since I was like 4. My family moved us here from California, and I've grown up here. I feel like I'm a true Arkansan. And I have been with EAC for almost 2 years now. Well, actually, yep, it's been about 2 years now as a community health worker. And then I have moved up to the community health worker program coordinator position. And I got into this work previously. My degree is in human services. So I've always known that I've wanted to help people and connect with people on a personal level and just hear their stories, walk with them through their life. And I used to work at a treatment center and for women and children, and I absolutely loved it, but I needed to take a step away. And then that's when I moved into this community health worker role with EAC, and I have loved it, every minute of it. I love being able to be out in the community and educate people on what we're doing with EAC, volunteering with other agencies, just however we can connect to the community and work together. I think there's a lot of different agencies out there, and sometimes people can kind of look at it as a competition, but I see it as like we're all working towards the same goal, and that's helping our community. So finding ways that we can connect with them and work towards making our communities a better and safer place.
I love that. And, community health workers hold a special place in my heart because they were some of the folks who really taught me how to really do linkage to care. And so there's a special formula, I believe, for community health workers. Can you tell folks a little bit about the role? Maybe what does a typical day or week look like? Some of the primary responsibilities, things like that.
Yes. And so typically, day to day, one of the biggest things I'll start with is community health workers. We need to know what supportive services we have in our areas that we're working in. And so one of the things that I started doing, and I have the other community health workers doing, is finding what resources are in our communities that are going to help people. So when we do get a client that comes to us and they're having food insecurities, we know exactly where we need to send them. So linking them to those supportive services. And that even goes with linking them to care. If they call, if we get a new client that just moved into the state, they're living with HIV and they might not know what services they are. So knowing where our care is, what clinic is open, which provider in our area is a Ron Watt provider. So we definitely focus on knowing what's in our area. We also do a lot of education and prevention and testing out in the communities. So throughout the state, we all have many different and a variety of different places where we go into facilities like treatment centers, day centers, like homeless shelters. We educate the community on STDs and HIV, like 101, prevention methods, the use of condoms, working on any kind of stigma that might be there through education. and then a lot of like myths that people might have regarding STDs and HIV. So we do a lot of education, and then we provide the free STD and HIV testing to the community as well, along with that. And so we do have several continuous monthly events throughout the state, and we're always working on getting more. Or here lately, we've been working hard on getting onto college campuses for education or just health fairs, getting it out there, helping get the youth of our state talking about these things that are happening, and making it a normalized thing for them to talk about.
Yes, normalizing the conversation is so important. Now, we know that the initiative, the Community Health Worker Initiative, is statewide. Can you tell the listeners the different areas where you have a team member?
Yes. So Central Arkansas, we have two, Kimberly and Cody, and they're amazing. Dee is in Texarkana, and she's beautiful and amazing as well. Johnny and I are in Fort Smith, and then we have Lauren up in Northwest Arkansas at the Rogers office. So, and we do travel all over. I know that in Central Arkansas, they sometimes go into like Southeast Arkansas as well. We've done stuff up in the Jonesboro area. So we definitely travel all over, but those are our main offices that we have with community health workers working at.
Yes, that's perfect. So no matter where you are in the state, there's someone pretty close to you that can actually provide you those resources. So please, please, please tap into those as much as you need. And if you are an organization that would like testing or any other services that EAC provides, please look us up. Now, Willie, you mentioned youth, and next month we have an HIV Awareness Day focusing on the youth. Tell me, why is it important that we talk to the youth about HIV prevention treatment?
Well, personally, it's super important to me because I have two teenage boys. And I do, since probably sixth grade, when they came home and started asking questions, my husband and I realized then that it was important to open up that conversation with them. And so through, being their mom and watching them grow into young men and them going through the changes that teenage boys go through and then noticing females, we want them to feel comfortable coming and talking to us about what's going on in their life. And so with that, I've gotten a huge interest in the youth in Arkansas in the states. I do know that in the state of Arkansas, there is regulations about what is taught in schools. They don't call it sex education, they call it health and safety. And so it is left up to the schools on exactly how that curriculum looks like when it's being taught in schools. So there is some form of education being taught in schools, but I definitely think it needs to be more comprehensive and more detailed in what they are teaching our youth. I definitely 100% believe that in 2024, there should be no teen pregnancies. There should be no teens that are needing to be treated for STIs or STDs. We're with the advancements of, the medicines and the research that we know and all the many ways we know how to prevent a variety of things through condoms or PrEP for HIV. We shouldn't having to be worrying about our kids necessarily having to struggle with a teen pregnancy, or what happens if they do get an STD and what that happens to them emotionally and physically.
Mm-hmm. And so it's really important that we do have these real conversations. So how do you think we can advocate for more real talks? Maybe not in the schools, but maybe in the community. And if it is something we can do in the schools, maybe there too.
Yes. So for me, the way I think of it is, again, I just go back to starting that open line of communication with people. We do live in a very conservative state. And so I think for so long, it's just been taught like abstinence in schools, and that's the best way, which it is the best way to prevent a teen pregnancy or an STD. However, I think that we need to look at the reality of what's happening in our state and what's happening with our teens. And so I definitely think just, having more communication in general, starting like groups within the communities or even within the church. I know a few people within that are faith leaders that are starting to open up more about like what can we do as youth leaders within our church to help educate these kids, or be a person that they know, like if we have a question, like you can come and talk to us and we're not going to push it away or shun you because you have these questions or concerns just because we are in a church. So I think there's a variety of different ways. I think the Boys and Girls Club would be a great way, because I know that in the state of Arkansas, there's many people that utilize the Boys and Girls Club, which my kids have, and it's a wonderful place. And so I think that's another great way, just training people that are in those positions on what's really going on, like actual sex education for those adults. That way, when kids do come to them, they have the answers and questions that the kids are needing.
Yes. And going back to that, reaching out to the community health workers in your area. So, very knowledgeable of those resources, of the advancements that we've made. Even within the past 3, 4, 5 years, there's been a lot of advancements. Now, let's go back to the community health worker role, because I want to know some of the challenges that you may face in your role and how do you address those challenges?
Oh gosh, we do have a variety of challenges, and I think the challenges are different depending on where we're at in the state too. I think that's important to know. I do feel like Central Arkansas might have different challenges than what Fort Smith might have. For my area in the River Valley, one of the biggest challenges that I've come across is, again, people shying away from the topic of sexual education and prevention, HIV education. And so that's been a challenge here. And so in the 2 years that I've been with EAC, one of the things that I have found that's been the most helpful is just showing up in my authentic self and being who I am. And there's been people when I first started in Fort Smith in that area that were like, I think you're great. I think what you're great's doing, but it's not what our company, our values don't align. Like it was a faith agency, things of that nature. But I kept, showing up at the same tables. I kept, just showing them that it doesn't need to be stigmatized the way it is. And now a lot of those places we are working together and we have partnerships. And I think it's through just the continuous, like showing up every day and meeting people where they're at. And they might not want to talk about it now, but in a few months now, they might come across a problem and be like, oh, I remember Whitley from this event. This is what she helps with. Let's actually reach out to her now. And so that's something that I encourage all the community health workers in Arkansas to do. Like you might reach out to somebody in the community, another supportive service for clients in that area, and they might be a little reluctant to use our services or want to partner with us. But if you just keep coming back around and just showing up, and eventually like they might come around and they might start using our services. If they don't directly use our services, they definitely can refer people to us, because we do a variety of different things like in-office testing as well, along with the public education and testing. And so there's different ways that we can go about that. And so I think that's just one of the most important things, is just understanding like not everything's going to be perfect with our job, and we're not always going to get it right, but just the next day is a new day. So how can we make that day better, and what can we do to move forward to learn from the, road bumps that we've come across?
Yes, that's important. The next day is a better day to try again, and always striving to do your best. So your best is all you can really do. So I love that piece. Now, on a positive note, tell me what are some of the most rewarding aspects of the work that you're doing or things that keep you going as a CHW?
Gosh, I love all of it actually. The good and the bad. Like when I graduated high school, I thought I wanted to be a nurse. And so I started that and I was like, oh no, that's not for Whitley. I knew I wanted to give back and I knew I wanted to be, a beacon of light per se for people that might need it in ways that I needed it when I was younger. And so, one of my favorite things is just being that person and knowing that like when certain people in the community see me, whether they're clients or professional people in the community, like they're excited to see us and they're excited to see EAC as team somewhere. And so it's really great being able to see us grow as a company and be those positive lights out in the community for a variety of different people that we're serving. So that's probably one of my favorite things is just the community part of it and just really striving to make our community better for ourselves and then for the, going back to the youth, for the ones that are growing up in it right now. So I definitely love that the most probably.
That's so cool. And you talked about building networks and partnerships. Tell me, what's the importance of building those networks and collaborations as a CHW?
Again, that just is going back to like literally what a community health worker is. And it's just knowing your community and working in your community. So going back to the supportive services, the services that offer like linkage to care. So it's super important when we do have clients, we're at a testing event, a client comes back reactive for, say, syphilis. In that moment, linking them to whoever we need to link them to start the process to getting them treatment. So it's super important to have those connections because with those connections comes, oh, here's my personal cell phone, Whitley. When you get a reactive, call me directly instead of calling the main line and we'll get an appointment within 24 hours for this client. Calling that person saying, hey, we got a reactive, her saying, hey, I'm not busy right now. Can you bring him in? And one of us transporting the client straight over to the doctor's office. So within an hour of them finding out they were reactive for something, getting them treatment. So I think it's important for those aspects or meeting new people that come in. We have a support group. And so for people living with HIV in the River Valley. And so when another agency calls and says, hey, like we got this new client in, they're living with, we're recommending them to your support group. Can they get transportation to that? And so that's where the community connections are super important, is just us knowing what's out there and people knowing what we're doing in the community. It wouldn't work. Like we couldn't be community health workers without those community connections.
Mm-hmm. I love that. It's really important to build those networks and actually have genuine connections with people outside of just what they can do for you. So I love that piece. Now, we know that there's been a lot of technological advancements in the industry. How has technology played a role in your work, especially in reaching and supporting individuals in the community?
For me, I just feel like I'm not a big tech person, so for me, I might be the wrong person to answer that. But it's been nice that a lot of things are online now. And so if I get a client that calls and says, hey, I need help with X, Y, and Z, like I can shoot them a link right fast to what they're needing help with. So there's a variety of different ways that it's very, very, very useful for sure. There's a supportive service with it's called 211, I believe it is. It's through United Way with Arkansas. And that's been a great service because that also helps with free transportation to and from a variety of different appointments. There's one for Narcan services as well that you can download, and it helps show you different places that are offering free Narcan training and then places that you can get free Narcan. Again, so there's a lot of amazing apps and technology out there to help our communities to make them better for sure.
That's cool. And you answered the question perfectly for people who may need to know. And I'm glad that you mentioned Narcan. Now, it's important that we do talk about the intersectionality of folks' lives because we know that no one person is a monolith, right? So, why is it important that we do treat the whole person when we are talking about HIV and other issues facing the community?
I think it's important to note that in the state of Arkansas, I believe, I don't know if it's all of US, but I know in Arkansas, the second way that HIV, the second most way that HIV is transmitted is through like IV drug use and people that are the co-occurring like addiction. And so somebody that had grown up with a father that was an addict and working in the treatment centers, that whole section of life has a very special meaning for me. And so I think it's important to meet people where they're at, because like we might be at a college campus one day and, you know, depending on like, there's a variety of different people there. We might be at a homeless shelter the next day. So it's super important to meet people where they're at, especially when we go into treatment centers. We might go into a treatment center and it might be that person's first day there. We might be in a treatment center and it might be that person's, 28th day there. So I definitely think it's important to realize that there's many different people that are going down many different paths of life right now. And we're not there to judge them. We're there to help them in any way that we can. And again, I love the saying, like meeting people where they are. And I try to not focus about where they've been, but how can I help them move forward and where they're going? So like, what are their values and how can I, in any small way, help you move towards those values that you're working for?
That's an absolutely great point because I feel using I statements for so many years of my work in prevention or even in linkage to care, I always jump to the resolution that I felt like they should receive. And I think so many people still do that. So you made a great point of saying, what are the values? What are the goals of that person that we're trying to reach? Our mission should not be get them to where we think they should be, is to get them to a place where they want to be more in a healthier way so that we can be safer no matter what it is that they are doing. So when we're meeting people where we are, we have to actually do that by the full amount of those just few words.
Yes. And it can be very hard because if you have a caring heart and you're doing what we do as community health workers, you want people to get better. And so sometimes we do, and it kind of can be selfish. Well, I want you to try harder. And so it's important to understand that like my 100% might not be the next person's 100%. They might be giving their 100%, but it might not be what my 100% looks like. And so understanding like they are most likely doing their best at what their best can be at that time. And so just trying to understand that when it comes to us meeting people out in the community.
Mm-hmm. That's amazing. I'm over here getting even more inspired. So let's talk about the future a little bit. How do you see the future of HIV advocacy and community health work evolving?
Oh gosh, in so many different ways. Coming up, the community health workers, we have Arkansas's having a community health worker conference. And so I'm super excited for us to meet other community health workers and what other community health workers in Arkansas are doing for their communities. And then I definitely want to work on us just growing as individuals ourselves in our personal and professional life. And so finding more ways of how we can grow, like through educations, trainings, things of that nature. I think knowledge is power, but it's only power when it's shared. And so I think that us learning more knowledge and getting a bigger knowledge base so we can go out and share that with others. I think that's my goal, is for the EAC community health workers, is for us to get as many trainings and go, to other places or train in other parts of Arkansas with other community health workers and see what that's going to look like and what they're doing in their communities and how we can incorporate that into our communities.
Now, look, Whitley, tell the people where they can find you if they need to contact you or anything like that.
They can definitely call my cell phone or text it. It's 479-353-3064. And then my email for EAC is whitley@engagingarkansas.org.
Awesome sauce. And do you have any parting words for the listeners today?
Just remember that you don't know what anyone's going through. Everyone has their own battles that they're struggling with, whether they're smiling or not. And so just always to be kind and meet people where they're at.
Oh, that's beautiful, Whitley. I appreciate you a million times for joining us today. This has been great.
Thank you so much.
And if you're out there, we thank you for listening as well. Don't forget to check out engagingarkansas.org. If you want to be a guest on the show, reach out to any one of us and we can absolutely hook that up. But for now, we'll say ciao. Say ciao, Whitley.
Ciao.
The EAC Speaks podcast is partially supported by the Arkansas Department of Health through a grant funded in part by the CDC. All discussion is solely the responsibility of each participant and doesn't necessarily